Hi everyone, this is Patricia from the International Hospital Federation. Thank you for joining us today in our last webinar for the year, Supporting Innovation at the Geneva University Hospitals. This webinar is being presented by Professor Karl-Heinz Krause, full professor at the Medical Faculty of the University of Geneva and President of the Innovation Scientific Committee of the Geneva University Hospitals. Professor Krause is full professor at the Department of Pathology and Immunology at the Medical Faculty of the University of Geneva in Switzerland. He has a joint appointment with the Geneva University Hospitals, where he works as an internal medicine specialist with a focus on geriatrics and infectious diseases. His research is centered around molecular mechanisms and therapy of age-related diseases. Professor Krause has also been active in the biotechnology field. He is inventor on numerous patents, and he is also founder of several startup companies, including Genkyotox, Nurix, TransCure Bioservices, Antion Biosciences, and HBoost Therapeutics. Professor Krause is also the Innovation Scientific Committee President of the HUG and organizer of the Geneva University Hospitals Innovation Day. Professor Krause, welcome and thank you very much for joining us today.
Hello, thank you very much for the nice introduction, and it's my pleasure to talk to you about what we're doing here at the Geneva University Hospitals in order to strengthen innovation and keep our system fluid and innovating. So, but I would like to start, before talking about it, to give you a little quiz. And the question is, who was this innovator? So it is a gentleman who was very active and did a lot of things in his life. Between the age of 20 and 30, he leaves college because of bad grades and continues professional training at a bank. He founds a YMCA chapter in his native city. He creates an international company and starts a winemaking business at a quite unusual place. All this between the age 20 and 30. Between the age of 30 and 40, he manages to get an appointment with the head of state to discuss removal of trade restrictions. So you can see he was clearly a free trader. And he wouldn't be happy about some of the political things going on right now. But also at this time, he sees something that makes him one of the great innovators of mankind. At the age of 73, he gets the Nobel Prize. Okay, so our quiz is question number one, who was this man? So Albert Einstein, Linus Pauling, Wilhelm Röntgen, or Henri Dunant?
All right, everyone, you have the option to click your answer on the screen. We have the poll there in progress. So just select the answer, and then we'll see how many gets the correct answer afterwards. And you also have the second question also displayed on your screen. So just select which you think is the correct answer.
I'm curious. How many of you find the right answer?
Okay, so I will share the results. So 57, for the first question, 57% answered Albert Einstein. 30% answered Wilhelm Röntgen. Professor Krause, who was the correct answer?
Can you give us the results of the second question, and then I give the answers?
Okay, so for number two, 14% answered structure of vitamin C, 57% answered the first X-ray pictures, and then 29% answered the universe through a high-performance telescope. So the most of the people answered Albert Einstein for number one, and then for number two, the first X-ray pictures.
So I apologize, I guess my quiz was a little bit too difficult, but the person I was talking about was Henri Dunant. He's a native of Geneva. That maybe explains why I'm particularly attached to him. but he was one of the great innovators of mankind. And what he saw was the Battle of Solferino, was a battle between the Piemonte and French on the one side and the Austrian on the other side in 1859, where about 50,000 people were left either dead or wounded on the battlefield. And he was there by coincidence. And what he saw just shocked him. There were 10,000 of people left to die on a battlefield. And he spontaneously organized in the city where he was. He asked all the people willing to help, and there was the first time that on a great level, all the wounded were carried out from this battlefield, and people tried to help them. He even organized spontaneously a hospital that he organized in a local church, so there would be some way to take care of these sick people. And then, of course, his great innovation was the founding of the Red Cross and the declaration of the Geneva Convention, which you all know. Okay, so that was my little introduction about a great innovator in health-related issues. He's a person from Geneva, and I think in his way, he changed the world a little bit for the better. Okay, now let's go to what we're really interested in. HUG, Hôpitaux Universitaires de Genève, so Geneva University Hospitals. And just to give you some numbers, we are well, it's written here number one, I would say the biggest university hospital in Switzerland. This is mainly because we don't have a separate city and university hospital, but everything is combined in one big hospital. So we have about 2,000 inpatients. We have around 1 million of outpatient consults per year. We have almost 12,000 employees, which means we are the biggest employer of the canton of Geneva. We have a total of 180 different professions, and this is going to be important when we talk about innovation, that we don't have only doctors and nurses. We have a lot of different people there. And of course, the university hospitals are strongly associated with the medical faculty of the University of Geneva, which is, of course, important for biomedical research and international visibility. So let me give you some numbers about innovation in Switzerland and Geneva. You know, every year there's a global innovation index. And I don't know whether you saw it, but here's the top 5 innovating countries. And Switzerland, since quite some years, is usually on the number 1 of the whole list. Now you can say, okay, that's trivial. Switzerland is a very rich country, so it has a lot of money, so they innovate more. But interestingly, even if you look at the innovation on the y-axis here, and compared to the riches of the country, of course, the more money you have, the more you can innovate. But normally, if you innovate according to your income of the country or the gross national product, then you should be on the black line. But Switzerland, you can see here very lonely on the top, is far above this line. So what's the secret of Swiss innovation? Okay, here comes a little joke, I admit it, but you might have seen it. Chocolate consumption and the number of Nobel Prize laureates per 10 million population are quite strongly correlated. But of course, the fact is, we don't know why Switzerland tends to be a very innovative country, but we are quite happy about that. And we are trying to transfer the spirit of innovation also into our hospital institution. And that's what I'm going to talk to you about now for the rest of the talk. No, sorry, I should add one more thing, more specific data about Geneva and innovation. What I could find there is published a bit more than a year ago, is this Nature Innovation Index. It was an interesting attempt. Usually when we try to judge the quality of science, we ask, you know, how often is a paper cited by other scientists? But of course, this is a little bit serpent who bites his own tail. You know, it's a circular argument. So what they did here, they tried to look how often are publications from different universities cited in the patent literature. So patent literature, assuming that this is what's really important for innovation. And this is very interesting. Of course, on the top 3 places, there are some American institutes. The first institutions, the first European institution is the University of Strasbourg on place 16, and on place 21 comes already the University of Geneva. So we do indeed have here a type of research that is of interest to the people who make patents and who do innovation. But I should also mention that the other Swiss universities, they come out very, very nicely in this Nature Innovation Index. Okay, and now we really go to our to the hospital situation, and that's something that comes back to the fact that we have so many different professions here. If we limit our innovation only to some medical professions, it wouldn't be enough. So we really need the medical innovation, but we have a lot of technical elements. We have the administration, we have human resources, we have architecture, environment, and many more. And innovation in a hospital context is not a good innovation if it only takes one point. What we really need is an innovative environment that allows all the aspects of a hospital to be constantly innovating. How to get there? I will try to talk to you a little bit about our efforts to do that. I'm not claiming we are perfectly there, but at least I can tell you that we're working hard on it. So one of the big questions is, of course, how do innovation, top down or bottom up? And you can see from these pictures clearly, my opinion, good innovation has to be top down, but bottom up, of course. So why bottom up? I think the quality of the ideas and their implementation, because the people on the front line, they identify the biggest opportunities for innovation. So it's not the general director of the hospital who knows how to best structure the interface of the nurses with the patients. That's rather discussion between nurses and patients that will give the answers. But there's a second important thing, this is the empowerment of our collaborators. Humans, they really need to feel that they're in control of the course of their life. And this is not only important in the private life, but that's also important in your work. So if you feel that what you do, you can improve it and you can take a responsibility, then you are happier person. And on the other hand, you know, this lack of self-determination, if you always feel you have to do exactly what other people tell you and you cannot come up with good idea, this is one of the main reasons for burnout. So here, just show you, I will come back to him later. This is a technician of NMR, so some radiology machines, and he came up with a new way how to clean these machines because it was very bothersome. And you see just when he got an innovation prize here at, in Geneva, and you can see, you know, that he's happy and proud of what he has been doing, what he has been achieved. And that's exactly one of the important things about innovation. So what measures did we take at the Geneva University Hospitals to facilitate innovation? We basically did that in 2 steps. So the first thing I'm going to talk to you about, this is now about almost 15 years old. This is our innovation committee where I'm the president. And before me, I'm making this since about 5 years. And before me, it was Didier Pittet, another professor at our institution who was the chairman of this committee. What does our committee do? We organize just many things around innovation. We have an innovation cafe, and I will talk to you about it. We have an innovation day, and we organize ad hoc meetings. We also have an innovation center that's much newer. It was opened about 2 to 3 years ago, and I will talk about that to you at the end of my presentation. So what are the results? Just to give you some numbers, and those are not the latest numbers. I have to admit it was about 3 years ago that I took these numbers. We had 200 innovative projects that we followed up. We had invention disclosures, we got advice from experts, we made collaboration agreements, intellectual property contracts, and so on and so on. And we gave administrative support to all these innovators. please make, I want to be very clear, we are never telling our committee how people should innovate. We just let them come we encourage them to come with their ideas and their innovation, and then we try to be there to help them to implement these innovations. So we are not helping with the ideas, that has to come from the people, we are helping with the implementation. So what about our innovation cafe? As you can imagine, it's not really in a cafe, but it's in our innovation center of the hospital, and we serve coffees, sandwiches, and so on, so the people feel comfortable. It's done during the lunch break, and we just invite people from different domains to talk about their ideas of innovation or their projects in an informal way. This is a program from 2015, but it's a very similar in different years. Here, for example, one of them was a bioinformatician, Professor Lovis, who talked about how the technology can connect the citizen and health. Then we had two young guys who created a startup company, and they just were in the middle of it, and they just told us how things going, you know, where the challenges are, where the opportunities are. Then we had a professor of dental medicine who talked to us about how the 3D printing technology is changing the whole phase of dentistry. Then we had the cafe about the impact of social media on health and hospital issues. And finally, we had Professor Herschel talking about the perspectives of whether HIV can ever be cured, and if yes, what are the ways to do that. So this is typical, and we do this every year. We have about 5 innovation cafes. It's during the lunch break. There's always around 30 to 40 people coming, and it tends to be a thing that people enjoy very much, and they really like that we're doing this. Now, the big event of the year is our Innovation Day. So we have a call for abstracts, and then everybody can submit abstracts, and they will be selected either for a poster session or for a pitch session, or for what we call the Innovation Academy. And here you see the public during such an Innovation Day. And here you can see the winners of different prizes, and some of our committee together after the Innovation Day. Now I would like to show you briefly 5 individual projects from the Innovation Day, because I think you understand better what people are doing and why it is important to give a good visibility to our local innovators. So we have, I will show you 5 different ones. Let's start with InfoGates. So this was done by a pediatrician and bioinformatician who realized that parents waiting with their children in pediatrics, this can be a nightmare, and they don't know what's going on. They have no idea why suddenly another kid coming, and it's seen right away, and they have to sit there for a long time. So they made this screen, which can either be seen on the big screen in the waiting room, but you can also see it on your iPhone or on your smartphone, whatever you have. And it shows you, you know, in blue, those who have a problem, but it's not an emergent problem. In green, those would be the one that have a little bit of an emergent problem. Yeah, now I can start this whole thing here. Have a little bit of an emergent problem, and then in orange here you will see the real emergencies. And so the people understand pretty much where they are. This is the name of the child here, and they realize, for example, I'm here, and the reason why I have to wait longer is that here is a high emergency coming in, and this helps a lot to calm the parents, to take away the aggression, and also allows them, because it allows them to estimate how long it will take, if it takes very long, to go for a walk and follow up on their smartphone what the what the waiting time is most likely going to be. Here, completely different innovation. It was done by a physiotherapist, so it was not a doctor, it was not a researcher, it was a real person from the hospital who realized a major problem. Just to give you an idea, I have the numbers from the US, where there's about 10,000 above the knee amputations per year. And there are about 500,000 people living with an above the knee amputation. Now, the above the knee amputation has a problem. Because of the small bone surface after this above knee amputation, traditional prosthesis needs to be supported by the pelvis. And this type of prosthesis, however, interferes with the hip mobility. You can imagine this surface here is too narrow, so the prosthesis also attached to the hip, but now suddenly you cannot really move normal anymore. So what's this idea of Alain Lacrosse, this physiotherapist? He said, what we have to do, I have to explain to the orthopedic surgeon what I have to do. They have to put sort of a cap here. This is inside, directly on the bone, so under the skin, which is large enough that it can support weight. And so this is how it does it look like in a patient. And this now suddenly allows to wear a simple prosthesis without this attachment of on the hip. Here you can see Alain Lacrosse with this new prosthesis, and this gives a much better quality of movement for the patients. So this is typically a very good bottom-up innovation where somebody is not a scientist, he's not a professional innovator, he's not a boss of something, but he sees the patient and he knows where the problems are, and he came up with a very good idea. By the way, the whole thing is now commercialized and it's used in many places, not only in Geneva. Here, completely different type of innovation. Here, those are two professors at our medical faculty, and they found a non-for-profit foundation, the Mintaka Foundation, which tries to address problems of resource-limited countries. And indeed, in these countries, a large number of young women die or become seriously weakened because of uncontrolled bleeding after giving birth. This is not a problem in our countries. Why? Because this mortality and morbidity can be prevented by intravenous injection of oxytocin. However, this is unstable in warm climates, and intravenous injection is often not possible. So what they have developed is a dried powder of oxytocin that can be inhaled, and that works as well as the injected one, and that can be very easily stored under hot conditions. It's very low cost, and it is about to be introduced into resource-limited countries and should help to save a lot of lives in young women. Another very important thing here, this comes from our School of Pharmacy, together with the head of the hospital pharmacy. So this is School of Pharmacy, Serge Rudin. This is an inventor who's a little bit outside of the direct hospital circuit, and this is the head of our hospital pharmacy, and they work together to find a low-cost system to detect fake pharmaceuticals. They managed to do that. It's a really low budget capillary electrophoresis, and the first instrument was installed in 2015 in Rwanda. And finally, the person I talked to you about before, this cleaning of the NMR machines used to be a real acrobacy, and people often hurt their backs because it was so complicated. And here I found this very simple trick how you can do that without a lot of gymnastics like you see here. And it works very well. It's very low tech, but it's a very efficient invention, and we calculated the gain of time. It's about 650 hours per year. So it's a substantial also financial interest in the whole story. I told you before that we are not only having our innovation days or innovation cafes, but we are also organizing ad hoc meetings or little congresses when we think something is important. And this was just about 2 weeks ago. We had a conference on blockchain technology in healthcare and life sciences. So this is another tool how we quickly can get hot topics into our hospital and ask people to learn more about it. So this is what we started about 15 years ago, and this is a system that works. Now I want to show you what happened recently, but before, allow me to tell you a little bit theory about innovation. If we don't do anything, this is the typical innovation profile in a big enterprise. You have about 5% idea creators, you have about 10% of idea supporters and promoters, and you have about 85% of people who do not want any innovation. They don't want no change. So here, this is very important. This is the spontaneous situation. So what can we do? So the most important thing is to create an innovation culture. We have to create enthusiasm for innovation. We have to show everybody that this is a good thing. They're not supposed to be reserved. If they have a good idea, they're supposed to go ahead with it. We have to implement tools, methods, and programs that enable expression of an innovative spirit. And an example is the attempt of the car maker Toyota to generate an innovation culture, and they have numbers for that, and they worked hard on it. And the number of annual suggestions per employee, they increased by 480-fold, from 0.1 to 48 in their main production centers. And the conclusion is that accumulation of numerous small improvements becomes a revolution. So it's not that we need one big inventor without one big idea. Also, this is also good, but to make a hospital really innovative and evolutive, we need accumulation of numerous small improvements. So in order to create this culture of innovation, our hospital has decided to create an innovation center that was opened about 2 years ago. Here you can see our new building of our hospital, and in this window front that you see facing here, there is the new innovation center. So the innovation center is not something that got hidden down somewhere in the basement, but got one of the best places in the whole hospital in order to make people feel that innovation is important for our hospital. And what this innovation center does, it tries really to put together everybody who's interested in innovation and make people understand that this is a priority for the hospital. There are many things internal to the hospital, so our scientific committee, there's an operational team and a board of directors, there's a platform for patient partnership. This is very important. And I should say that our innovation scientific committee in the beginning did not have patients involved, and that was, of course, we didn't do that right away, but now we do, and I think that's a very, very good thing. We put all the innovation specialists together, but of course we are not there specifically for the specialists, but we're there for everybody. There's financial resources which are attributed to innovation there, and the different divisions of the hospital, they have their representatives there. And of course, this innovation center always looks for partnership outside of our hospital, and that's another very important aspect. So what I said before, it's about creating this culture of innovation. I talked to you about the innovation days, innovation cafes. We also have these so-called hackathons, where people who have questions that could be answered with the help of informatics come together with informaticians and specialists in computer science, and they develop new solutions. That's something very original with a lot of interesting results. And we have meetups, training sessions, thematic talks, and many more. So this this innovation center is really something which is there to tell people, yes, innovation is important. Yes, you can come here. If you have a good idea, don't hesitate to come. We are there to support you. This is a nice slide about the different hackathons we had. I don't think I have time to go into details. So a lot of these things that we are doing here are being commercialized. I told you this above knee amputation nail, which is shown here again, which is one of the very nice success stories of the innovation, but there are many more. And finally, here you can see the operational team of our innovation center. Professor Geisbühler, a colleague who's an expert in medical informatics, who's heading this innovation center, and here the three people who directly work for this innovation center. And with this one, I would like to thank you for having listened to me, and I'll be happy to answer any questions that you would have. Thank you.
Thank you. Thank you very much, Professor. We'll start reading some questions from the audience shortly. Just to remind everyone, you can send your questions by typing them in the Q&A tab. You can find it at the bottom of your Zoom webinar screen. So before we proceed to the questions from the audience, I actually have a question. You mentioned about the innovation committee. I was wondering if you can tell us more about it, how it's structured, who are the members, and so on.
Yeah. So I mean, the idea is of our innovation committee is to have really a informal and closely together working committee. So our structure is flat. I mean, I'm the president, but that means only that I do most of the organization. And if you look on the, I don't know whether you still see the picture here. On the left side, you have Aurelia Weber here, who's helping me with organizing this. So if you want, she's the general secretary of our innovation committee, and together we organize this. But once we are there, we're sitting around the table and we discuss the most important topics, and we do brainstorming how to best proceed with innovation. Now, how do we select the members? It is basically the idea to bring together the people who have shown interest in innovation or already have experience with innovation. They sit around the table, but not with the idea to advance their own projects. Of course, they can do that, but that's not the reason why they're members of the committee. But they are there as members of the committees to help other people who are about to have some good ideas, to make some innovation, to help them in an optimal way to proceed and to be able to do what they would like to do. So we are really people with a very mixed experience. There are some people who are classical medical doctors, surgeons, some are scientists, some are nurses. We have one representative of the patients, and all this together makes a committee which is at the service of the innovator.
Thank you, Professor Krause. At your Innovation Day, we've seen here in your presentation, you have people with very different backgrounds, expertise, and different types of innovation. So for example, the radiology technician who invented the new type of cleaner for the NMR, the one who developed the oxytocin spray to save women with severe bleeding in resource-limited countries. So there's really, a variety, different kinds of people and innovations. Do these very different people mix, and is there a creation of synergy?
Yeah, this is a very good question, and it's really this is really one of the amazing things, that in the beginning, of course, these people are a bit far away and they don't know each other, but they start to know each other better, and they all start to feel they are part of a community of innovators. And it's very interesting how since the beginning of our innovation days and our innovation activities, these people have grown together and they work together and they think together. And even if the innovations are very different, they feel part of this community of innovators. And I think that's a very positive outcome of all our efforts.
Thank you, Professor Krause. So you mentioned this ad hoc conference on blockchain technology in healthcare and life sciences. Is there the emergence of really novel healthcare-related innovation in this domain?
Yeah, so it was interesting for me. I have to admit, my initial interest in this blockchain technology is that it allows basically to revolutionize the investment in biotech companies. You know, some biotech companies, they are doing something good, but there's not a lot of interest from the typical investor there because they don't feel there's enough money to be made with it. So blockchain technology allows to address people all over the world that want specific medical issues to be solved. And that's one of the interesting things. But I knew about that. But what I really learned new during this day is to which extent this gives a completely new dimension to patient data. Because until recently, the patient itself wasn't at all able to decide what type of data he agrees to give away for clinical studies, for example, or for people searching new ideas. And I'm not. I mean, I don't think we should be negative about these people trying to get patient data, because otherwise we can never innovate in the field of medicine. On the other hand, the patients like to be their own. They like to take the decisions on their own. And I think that's what blockchain technology makes perfectly possible. Everybody suddenly can be the master of the data about his health, and can hopefully contribute as much as possible to a better understanding of how patients are doing and how we should take care of them. So it really empowers the patient to participate in the whole healthcare circuit. And I think this is a really interesting and major potential of the blockchain technology. And that was completely new for me.
I have one more question, Professor. How did it, this whole process of creating, you know, the Innovation Center, the Innovation Committee, how did it happen? Was it something that HUG just decided, or was it a long process of coming up with this plan and putting all this initiatives together, the Innovation Day, the hackathon, and all these activities?
Yeah, so I think it was not like a big decision taken one day. It was rather a stepwise procedure. For example, when about 15 years ago, the Innovation Committee was generated, you know, it was I think it wasn't a very courageous thing, but it turned out that my predecessor, Professor Pitte, he did an amazingly good job to show that this is something that is important for the hospital, to give it visibility. And then suddenly the hospital director realized, well, this is really interesting. There's a lot of interesting things coming out. At the same time, our medical informatics people, they're doing a lot of interesting work, and they started to do these hackathons. Again, this contributed the whole thing. And then when this new hospital building that I showed you was built, suddenly there was also a new hospital director. There was so much visibility for innovation that it was felt that it's really a good idea to create this special place dedicated to innovation at our hospital. So yes, I would say it was an evolution, not a revolution, but as I said before, you know, many small steps. If that go in a good direction, even if each one of them is only evolution, altogether it can make a revolution. And I think we are at the verge of this.
Thank you, Professor. We have here a question from Chan. The pediatric wait time application you showed, InfoGates, I believe, he said this was very good. And he's asking if this is a commercial application that is available for purchase outside Switzerland.
Yes, so they are working on this. I don't think it is already available. I think for purchase, I think they're collaborating. I don't know whether they already have English version because the present version that I know is in French. But I'm sure they are very much interested in collaborations. And so if you're interested, then I can put you in contact with them through an email address.
One question is, what do you have pointers on how to create a culture that supports innovation? In HUG, we've seen it, but for other hospitals who haven't really done a lot around, promoting innovation within their institutions, do you have any tips on how to create that culture?
Yeah, so I mean, of course, there's no miracle, and it always depends also on the people that are around you. But I think creating visibility and reward is certainly one of the key things, and this is our Innovation Day, which creates that. The people, the innovators, they can show their project. And usually that's very nice. When they show their project, there's a lot of people of their structure that are come, if it's from the intensive care unit, and suddenly 10 people from the intensive care unit come to listen to our Innovation Day because they get excited about their colleague presenting something. And so this is good for two reasons. First of all, then there's a valorization of what the inventor did. Suddenly a lot of people listen to what he does and it makes him feel good. And at the same time, new people coming who maybe never thought about innovation, but suddenly they liked it. And then I also saw that the one reward is simply that is the visibility. The second reward is that we have prizes. They are in the range from 1,000 to maximum 5,000 Swiss francs, so they're not huge. And these prizes are not like you can use it to go on vacation, but they are made to support your innovation project. And this is, of course, something that is also much appreciated. Even if there's a small amount of money, they can help to increase for a specific point of your innovation project. So I think this creating an innovation day is a very good, it turned out for us, it was a very good first step. And this is probably something I would recommend. And actually, my predecessor Didier Pittet, he is very active, and now there is this. There is 5 hospitals who have innovation days, which is very similar to ours, and once every 2 years, I think, we make an international innovation days where the 5 hospitals, they sort of run against each other. All the best innovators from this hospital, they come, and there's a competition going on. And that's a very nice thing also. So I would strongly encourage you, if in your institution you can create such an innovation day, do it, and the whole Geneva team will be extremely happy to help you and give you some tips with that.
Thank you very much, Professor. So you can still send in a few questions. We'll try to answer them before we end our webinar soon. Another question, Professor, is what did you find were some challenges that you faced maybe during the beginning when you created, the innovation committee and you started with the innovation day?
Well, the worst thing, I mean, there's 2 things. First of all, there's the mentality, we always have done it like this. There's no reason to make it differently. So this is this inherent conservative element in human nature. I think human nature has both. It's not like we are pure innovators or pure conservatives, but I think everybody of us has these 2 aspects. And but if a system is not really built on innovation, you get this eternal thing. No, we always did it like this. There's no reason to change it. The second real challenge I would see is that some people, at least in the beginning, had the feeling innovation, this is sort of a luxury. If you don't have really something important to do, then you start to talk about innovation. But I can promise you, innovation is not a luxury. It's a necessity, and actually, not to innovate is a luxury we can simply not afford.
Thank you, Professor. All right, if you have any additional questions, you can still send them in. Is there a way to kind of measure innovation, or is there such a thing as measuring innovation?
So I think on the level of countries and even on the level of universities, I showed you some example how people try to do that. On the level of a hospital, it's a bit more difficult, because I don't think, also some of the good innovations we have are patented, but patents are very incomplete, because a lot of the good innovation is not directly, linked to a patent or something like that. So it's a real challenge to measure innovation at a structure. I think the best thing is what we are doing right now in our innovation center. So we have the luxury now to have 3 people who are really working on this topic. We try to measure a whole number of different criterias, not only one, but of course patents will be one, licensings will be one, but we're trying also to measure all the in-house changes that and the impact that things that are done within the hospital have on our what the impact of this innovation on our institution. And that's, at the end of the day, I think we're gonna be able to create a good picture of innovation at our place and on the dynamics, but it's not an easy task.
Mm-hmm. All right, thank you, Professor. So thank you to everyone who sent in their questions. If you think of any additional questions later on, you can contact Professor Krause. We'll send the contact details through your emails together with the recording of the webinar. Before we end the webinar, Professor, is there anything else you want to say to our attendees?
Well, it was a pleasure to talk to you a little bit about what we're doing here. And if you're interested in this topic, I can only strongly encourage you to go this direction. It is true, you will encounter resistance and you will encounter some hurdles. But at the same time, at the end of the day, when you feel something is moving in the institution in the good direction, then it's very satisfying. Yes, that's it.
All right, thank you, Professor Krause. Thank you for sharing the work and the initiatives of the Geneva University Hospitals. We'll also like to thank the participants, everyone who signed in and joined us today. It would be great if you can answer our quick survey, which will be shown right after the webinar. Again, we'll be posting the video recording on our website next week, and you will receive the link in your email. Before we end, I'd like to mention that we're actually, our knowledge strategies manager, Marissa Hilapetra, is here in our webinar today, and she'd also like to say a few words, just a quick word about the initiative that they're doing in the University Hospital Special Interest Group. Marissa?
Yes, I'm here.
Hi, yes. Go ahead.
Hi, Patricia. Thank you, Professor Krause. Thank you very much for this very interesting presentation. I wanted just to inform our speakers that the International Hospital Federation, by means of the special interest groups on university hospitals, is actually exploring the way innovation is fostered, managed, encouraged in university hospital settings. And of course, we are doing so in partnership, very close partnership with University Hospitals of Geneva. And so for any outstanding question, if you have any interest or any question, we would be very happy to inform you on the work that we are carrying on into this. This is going to be a long-term project. We shall be exploring university hospitals worldwide and trying to catalog best, or at least practices, and that's all. And this should be published in about 2 years' time from now and presented at the World Hospital, at the World Hospital Congress, yes, in 2020 in Barcelona. That's all I wanted to say. Thank you, Patricia.
Thank you, Marissa. All right, so everyone, thank you again, Professor Krause. Thank you very much. We hope you can join us again in our future webinars. The next one will be in February, and we will be talking about investment strategy of the Dubai healthcare sector and how the Dubai Health Authority is fostering public-private partnerships. So more information will be available on our website and social media accounts soon. So thank you again, everybody, and I hope you all have a great morning, afternoon, and evening ahead of you. Thank you again, Professor Krause.
Thank you.
Bye,
Bye-bye.
everyone.
Thank you.